Welcome back to the show. We have a great hour lined up. Dr. Stephen Mulholland is here. He is a leading cosmetic plastic surgeon at SpaMedica. Welcome back.
Thanks for having me back. Looking forward to it.
Haven't seen you for a while, and I would think this would be a busy time of year for you.
It's very busy. People getting ready for the holiday season and for festive events and parties, and so many non-surgical ways they can brighten up their skin and look a little fresher without surgery. And then people that use the holiday season to actually escape for a bit and recover from surgery.
I mentioned it to a couple of the guys earlier about people coming in for quick fixes for the holidays, and they actually kind of physically reacted. They didn't believe that there are minor things you can do to freshen up your look.
Well, that's the nature of guys, Generally, yeah. Skincare for most guys is Irish Spring. So,
Yeah.
But typically it is 92% of all aesthetic patients are women, and little quick fixes have taken over the industry. It's last year in North America, $15 billion was spent in cosmetic enhancement treatments, and of that, 82% is non-surgical. So, a little bit of Botox, some soft tissue fillers, a nice photofacial, some skincare, and a peel, and you could look 5 years younger, and really rock the mistletoe at a Christmas party.
Yeah, well, I guess those are the kinds of things people are coming in for now, because you want to give yourself enough time so that you're looking fresh for the parties, which are all sort of happening. Is there anything people can do that will have a dramatic difference that they could say, come in to see you today and go to a party tonight?
There certainly is. There's a whole host of new technologies, one in particular called the picofacial, which uses really, really, really short pulse duration laser light to create new elastin fibers in the skin and tighten, give you that sort of baby smooth type of complexion, and yet not a lot of redness and downtime, which some of the other lasers do give you. So we've got some pretty quick fixes, allow people to go right back to work. Even our injectables now are done with tiny little blunt tip micro cannulas with a sharp needle. You can plump up the lips a little bit or the smile lines and go back to work without bruising, and that never used to be the case. And Botox, the little bumps for the injection are gone within about 15 minutes, and most people do go right back to work if it's during the day, or go back, come in over their lunch hour.
What is most important when it comes to people wanting to look youthful? Is it skin tone? Is it wrinkles? What would you say it is that makes the most dramatic difference?
Well, first of all, we do live in a youth-oriented culture. As I get older, I wish we didn't. But of course, we created the culture. Now we're being victimized by our own creation. So we do judge the book by the cover, and we all intuitively understand that we value youth and youthful decisions and bright eyes and a sound mind. And we have so many euphemisms for the cult of youth. And so here we have a bunch of baby boomers getting old in their own cult of youth, and so they turn to treatments, not necessarily surgery, but low-risk, non-surgical treatments. And the most important thing about a youthful face is just bright skin, a glowy, smooth, even, bright integument without sun damage and broken vessels and large pores. And so just taking care of your skin, simple skin care, medical peels and photorejuvenation that evens out your color, your reds, your browns, and your pores will make your skin look bright, and bright skin reflects light, and that's youthful. And then, of course, plumping it up if you're deflated, and maybe softening if you're a little more over-animated. So I tell patients it's the 3 Ds of growing old: deflation, descent, and deterioration. And then the fourth dimension would be death, but we don't have reincarnation in our medical bag yet. And you just treat each of those Ds.
When people come in to see you for a consultation and you notice something that could make a dramatic difference, but it's not what they're complaining about or not what they're asking about, do you point that out to them?
You have to be careful. You don't want to feel like you're guiding a patient down anatomical derangement that they never saw. And so I'm very careful. I ask them first to list their concerns and what they want to have addressed. They have to fill out a medical history, including a psychological history and job history and family history. Make sure they're appropriate. And then after I've asked them top 3 or 4 things that bug them, what their goal is, what they want to achieve, is it realistic? If they're 65 years old and they say they want to be 21 again, clearly we have a gap. And then I'll just say, do you want to know what I think? There's a few things that in achieving your goal you haven't mentioned. You want to know what I think, and I just ask them their permission, and then I'll point out a few things that I think are synergistic with their goal. I don't go from they're complaining of dark circles under their eyes. Well, maybe we should lipo that outer thigh of yours. That's completely unrelated. So
Okay.
I try to keep it focused on what the patient wants to achieve. But I think it's foolish if you've got 25 years of experience of rearranging tissue and making it look great to not give them a few suggestions they might not have thought about. It's not like come in with I'm going to order what I want. Usually they want to know the doctor's suggestion.
Well, it's like you were hearing my producer, George, earlier was saying Frank Cona's in tomorrow. He's a home renovator, right? If I have him come and look at my roof and he says your windows could be replaced, I'm going to be thankful for that opinion.
That is so true. I mean, most people don't come in and order 32 units of Botox and 2 syringes. Yeah. I'm a facial contractor and they want me to renovate the main floor. Sure. And they want some suggestions.
Now, you mentioned 92% of clients are women, but is that true for your practice? Only 8% of men, or do you see more men coming through?
I think because I have a very central downtown Yorkville, Toronto practice, it's probably more like 20% are men. Mm-hmm. And then there's heterosexual, non-heterosexual men with different goals and expectations. But men have become much more they're sort of the metrosexual kind of, guy who's going to take some treatments for their skin and they're manscaping their hair and they're doing things that guys wouldn't have traditionally done. Again, competitive landscape, both on Tinder and in the job environment. And I see more and more guys, which I wouldn't have seen 20 years ago.
Yeah, we did a topic earlier about whether or not people feel pressure to look a certain way. And one guy called in and said he's been taking care of himself since he was 19, but he does it because he feels good. When you take care of yourself, you feel good. It's not necessarily for someone else. Yeah,
but the vast majority of people are doing it because they feel good. When they look in the mirror, they feel confident and that goes right to the hypothalamus of our brain and releases a little chemical called serotonin. And if that's what it needs to feel good, then so be it. It's a free world. I think you don't want to victimize people that have psychological dependencies and illnesses, but that's the physician's job. And then there's a whole group of people now that do it because they've got to look good. They're single. It's about a 5-second swipe out there on Tinder and all these dating services, and you basically you're getting swiped because of your appearance. Kind of sad. I call it the picture perfect face now that people are trying to achieve. With selfies, you tilt your chin down and you see a double chin where you hadn't seen that before. And all these dating apps require a picture. Now, if I post my grade 11 picture, they're going to be awfully irritated when we meet for coffee.
Yeah. And I guess that's the case, right? You want to post a picture that looks like yourself, as you do today, and somewhat flattering. And maybe Photoshop is not a good idea all the time.
No, it generally, unless the individual has suffering some retinal damage, they're going to be quite upset at that first encounter.
All right, Dr. Stephen Mulholland is here. If you have any questions, give us a call, 416-872-1010. You can text us at 71010. He is one of Canada's leading cosmetic plastic surgeons. He is at SpaMedica, and any questions you have around cosmetic surgery, around quick fixes for the holiday season, whatever it is, give us a call. You're listening to The Night Side. Welcome back to the show. Dr. Stephen Mulholland is here. He is one of Canada's leading cosmetic plastic surgeons. He's with SpaMedica. And we are here taking your calls and your questions on anything related to cosmetic plastic surgery, quick fixes, non-invasive things that you can have done. 416-872-1010. You can text us at 71010. Chris is on the line with a question for Dr. Mulholland. Hey, Chris.
Hi, how are you?
Good. How are you doing?
Oh, not too bad.
Good.
I kind of have a two-part question. I'm 42 now, and I don't do too much to really take care of my facial skin. I mean, I wash at night with soap, the basics. But first thing is there anything that I could do, like just with over-the-counter creams and things that would help kind of rejuvenate? Like my wife uses a nighttime cream and a daytime cream, and I don't do any of that stuff. But I don't know how effective that is. And second of all, I do have a bit of rosacea and kind of spider veins on my nose, and I was wondering what I could do to get rid of those.
Yeah, that's a good question, Chris. Most guys, as I say, Irish Spring is about as medical as we get.
Yeah.
And in general, most guys have thick, sebaceous skin, much more oilier than women. We have facial hair, which thickens our hair. It's not as delicate. A simple toner and a cleanser over the counter, like your wife might have, is really all you need. But you brought up the most important point. A lot of guys especially if they're Celtic North European, will have ruddy red tones to their face that gets deeper and darker with enlarged pores and broken capillaries. And that sort of rosacea look, that sort of Carl Malden, rhinophyma look is really well treated with something called a photofacial using intense pulse light. And that can really make your skin look much, much healthier. And so you're best off to look for a center that has a really lot of photofacial experience. Here's a series of 5 treatments, very affordable prices, $1,500 or so. Excuse me. You can look 70% more even tone. And then if you happen to be a listener who's Hispanic or Indian or Southeast Indian or Mediterranean, it's not usually rosacea, but brown discoloration, brown spots and hyperpigmentation, something called melasma. And again, laser treatments for that are wonderful. So most guys need more laser-oriented treatments, not your basic skincare products over the counter, because we have thick, sebaceous skin. That's kind of always going to look like crap. And we want to make sure it just isn't brown and isn't red and quite even in tone.
Isn't that true, though, for all of these skincare products that claim to lighten your skin, get rid of dark spots, really, how much do they do, or does it come down to getting some laser stuff done?
I think if the over-the-counter stuff is good for a toner and a cleanser, but the medical claims they make for, here, buy this cream, your cellulite will be smoother or your wrinkles will be less, they're really overextending the medical validity of those claims. I think you need to go to a cosmetic plastic surgeon, a cosmetic dermatologist with a lot of knowledge in the space, and there are medical prescriptive agents you can get, things like not retinol, but retinoic acid, not a lightener, but really hydroquinone and kojic acid. So things that we can, peptides and things that we can do that need prescription-based antioxidants and peptides and retinoic acids that you just can't get over the counter. So I think just have a good physician relationship with someone that does skincare and does medical-based peels to take down the thickest outer part of your skin called the stratum corneum, and then laser treatments and those simple things without any surgery. You could look 5 to 10 years younger.
Should guys be using moistaurizer?
Again, most guys do not suffer from dry skin. It's usually oily and sebaceous. Some do. Some have seborrhea. Some have dry skin. But the male skin is usually one of thickness and oily, sebaceous, porous skin, and then rosacea or brown discoloration. So moisturizers for guys can be helpful. But they're not going to, you're not going to look like, Brad Pitt when you're done.
Now, a lot of people planning to go away for the holidays. How does that jive with laser skin treatments and photofacials? Well,
it used to be, we'd tell patients that you're having a light-based treatment, hair removal, laser hair removal, or a photofacial, and you can't go in the sun for 4 weeks. I mean, those days are long gone. In general, once the photofacial effect has worn off, 2-3 days later, you can be out in the sun. You can walk around. You can have, you want to wear a sunblock and a hat. Probably not going to be, putting on your baby oil and iodine like 1978.
And give that reflector.
The aluminum foil reflectors. That's probably not part of your skincare regime anymore. But you don't have to be, second season of True Blood and living in a coffin either. You can enjoy the sun.
Okay, so I want to get to a question. It feels like a bit of an awkward one, but we've been talking about it in the break, and it's a story we came across. It has to do with a procedure that women are getting in part because of this craze around yoga pants and how much it shows. And women are getting labiaplasty, which seems to me like quite an extreme thing to do. But it sounds like it's something that a lot of women are interested in having done. Well,
the labia, for the listener, are there's the outer and the inner lip of the female genital anatomy, and the labia majora, the outer lip, the minora, the inner lip, and sometimes there's an overgrowth of the inner lip. And there can be real functional problems. Simple riding a bike or exercise, rubbing during intimacy, the labia minora coming in and out can cause pain. So it can be quite a functional problem, not always just cosmetic. And then cosmetic really never became a problem until the mid-90s when laser hair removal was developed. And suddenly women were getting laser scaping of their pubic region, and suddenly this
something appeared.
So suddenly, what are these? Oh my goodness! And we developed whole classifications of what's the ideal length of a labia minora compared to the majora, and labial resurfacing, labial augmentation with fat or HA gels to plump them up. But labial reduction is the more extreme surgical version, and typically, a responsible plastic surgeon is going to make the diagnosis of a functional problem. Someone who comes in with normal labial anatomy generally is not going to get a reduction surgery. So there has to be usually some functional component and then some cosmetic component. It's not covered, so it's a privately funded procedure. The labia are reduced, and then usually the normal sort of range of normal would be within a few millimeters of the labia majora, slightly inside the labia majora, so they don't get caught when exercising or when riding a bike, and don't become uncomfortable during intercourse or intimacy.
Are there many people who come in thinking they're in an abnormal situation, and then you realize they are actually in the normal range?
Well, whether it's labia or a nose job or breast augmentation or a guy who thinks he has gynecomastia, there's some that overvalue small issues, and then you should be tweaked to they have psychological issues, and they're really looking for surgery on mental issues rather than physical issues. So yeah, some people come in with disproportionate sense of a proportion, and then they're not candidates for surgery, usually just for maybe some psychological counseling.
All right. When we come back, let's talk a little bit about the gynecomastia, which we haven't really, I think, spent a lot of time on in the past. And also, Dr. Stephen Mulholland taking your calls at 416-872-1010. You can text us at 71010. He is one of Canada's leading cosmetic plastic surgeons. He's with SpaMedica. Welcome back to the show. Dr. Stephen Mulholland is here with me, cosmetic plastic surgeon at SpaMedica. The website is SpaMedica.com. We've got a bunch of questions on the text board that I want to get to. And if you have a question for Dr. Mulholland, give us a call at 416-872-1010. But before we move on, a couple things. We were just talking about women and labiaplasty, and you told me there's something similar for men.
Yeah, we don't want to leave the other gender out as well.
No.
There's the heartbreak of scrotal ptosis, which is when the testicles and the skin that harbors said elements droop too far. And so there's a classification system, believe it or not, and then there's a surgical procedure for tucking a droopy scrotum. And when you ask most men why they undergo this procedure, it's really for the locker room, not the bedroom. It's for the locker room and self-consciousness about, I guess, being a bit dangly.
But they're not worried about the women, it's the other guys.
Yeah, it's the other guys. I guess you say they're a little bit testy.
Yeah. And what goes into that in terms of recovery, in terms of cost?
Most of those types of procedures where you're moving a little bit of skin and rearranging some body part are going to run somewhere from $2,500 to $4,000, whereas a blepharoplasty or scrotoplasty is just removing a little bit of excess skin and getting some natural proportions or acceptable natural proportions. And the recovery obviously is a bit of a tender area, so you're going to be wanted to be well supported with not your tighty whities, and there's going to be some swelling and some ice, and you won't be intimate for a while, but generally it tends to be an older guy, and intimacy may come in cycles at that age. And you just pick one of the cycles when it ain't happening. You put the Cialis up on the shelf for a while, and you just recover.
Gynecomastia, also known as man boobs. You said something earlier that not a lot. You said some men come in thinking they have it. So do you often see people who think they have it, but they actually don't?
Yeah, so gynecomastia typically would be male glandular breast tissue. And some guys will come in with that, and they actually just have fatty tissue over top of their pectoralis major, their pecs. And so gynecomastia has been a little bit hybridized to include fatty breast tissue and glandular breast tissue. And some guys come in and they think their chest is big, and it's really just a big pectoralis major. And so glandular hypertrophy, or let's just say chest tissue, or the male boob, the moob, is the man boob, is a common thing with hormonal imbalances. It's a common thing with the estrogen and all the food we have now, from processed chicken to a lot of our foods. And in general, it used to be quite a procedure, like a male breast reduction with a lot of scars. Now with a lot of the modern liposuction techniques that melt gland as well as fat and give inherent contraction, you can avoid some of the deforming scars that we used to have to do for gynecomastia, and through a couple little small 2 millimeter millimeter incisions. You can melt the gland, remove it through the small incisions with products like Smart Lipo and Body Tight, and not have to undergo scars. Because sometimes guys are as self-conscious of the scars with a flat chest as they were with the protrusion. And so most guys do it because they want to wear a tight shirt, and then they want to take that shirt off when they get to a beach. And some of the new techniques allow them to do that.
All right, we've got some questions on the text board. Let's start with Lee. He's 54 years old. He has the proverbial turkey neck. What are the current treatments for that?
Turkey neck. So turkey neck usually implies is mainly loose skin and not fat. That sort of, jowly, dowdy look. And generally, we've got some good techniques for heating under the skin and heating on top of the skin with radiofrequency laser devices. And if it's modest turkey, let's say a 1 or 2 year old turkey neck, we can tighten that without surgery. We've got a lot of cool technology that we can use on the skin under local anesthesia, not induce any scars. But if there's a lot of skin, let's say you can grab your jawline just by the back of your jaw and you pull, and you can't see your ears, that's a 911 scalpel emergency. And then we do what I would call a guy lift, where we hide the incision inside the ear and behind the ear. So even if you're bald, even if you're Bruce Willis, you could do a guy lift and not have any visible scars nowadays. So it's usually done under local anesthesia, a turkey neck lift. It takes about 2.5 hours. The recovery is about 7 to 10 days. And you can be bald, or you could have long flowing hair, and no one's going to see a scar.
And does that usually go in conjunction with face stuff, or can people just have the neck and they don't have to worry about anything else?
And that's a very good question. A misconception, it goes back to the 90s and the 80s when women would come in and they were 70 years old, 65 years old, and they did everything. Nowadays, women and men are much more strategic. It's sort of like, military prophylactic strikes to keep the enemy at bay, and the enemy being decrepit, demented, droopy, and saggy appearances. And so often women will do their eyes in their 40s, and then maybe their cheeks in their 50s, and then it's a little neck in their 60s. So you never really renovate the whole house at any one time. It's usually one room at a time. And so we've gotten very good in plastic surgery, just renovating one room at a time, doing just a neck, just a gel neck, or just a cheek, or just an upper lid, or a brow upper lid. So small prophylactic strikes, renovating one room at a time, so the whole house always looks good, never worn. It's never a tear down.
So that's interesting, because I think we've all seen people and men and women, I would say, who look like they've either had too much done or had it done all at once. And is it a preference to do things for you a little bit at a time instead of everything at once?
I think it's a preference for patients when they find out it can be done, and certainly for the surgeon, because if you leave it all to the last decade and a half of your life and you're old and weathered, people are going to notice. If you just do things strategically, little bit at a time, you can grow old gracefully on your own terms, and you can do little tweaks. The recovery is less. Most things in the face are done under local anesthesia. You don't need a general anesthetic anymore. And you can always just look fresh and natural and good without looking done, the dreaded done.
416-872-1010. You can text us at 71010. Dr. Stephen Mulholland is here from SpaMedica. We've got another question. Hi, my background is West Indian, and a genetic condition that I've inherited are circles under my eyes. I've noticed that as all my aunts have aged over the years, the dark circles become more and more pronounced. I've researched under eye fillers, but I'm nervous about needles in this part of my face that is so close to my eyes. Do you have any advice?
That is such a common problem, the under eye. And I divide under eyes into that Celtic North European, a blue tinge with some engorged veins, almost like leg veins of the lower lid, and some fat pads. And then we need a laser that works on the veins and some filler for camouflaging fat pads, and sometimes even a lower lid blepharoplasty. Then on the opposite end of the spectrum would be a West Indian, Southeast Indian, sometimes Mediterranean, where you have dark melanin, deeply embedded dark melanin and dark circles without some hollowing or a fat pad. And in that situation, the melanin is so entrenched and so deep, there's no laser that will simply reduce it and not cause hypopigmentation or lightening. So for the truly dark Mediterranean lower lid, Southeast Asian, Indian, West Indian, you're resorting then to soft tissue fillers. And most patients, like our listener there is right. You want to be nervous around the eye, so seek an expert. Generally, most experts like myself will not even use a sharp needle around the eye. We use these tiny little blunt micro cannulas. We sneak in under all the tissues and come out, and we and keep the blood supply to the eye and the eye itself very safe. So soft tissue fillers will help with the darkness by getting more light shadow reflex. And unfortunately, we don't have a laser to relieve the deep melon without lightening the skin. And so you have to rely on fillers to camouflage.
All right, we've got Ron who texted in a question. Dr. Mulholland, I'm a 60-year-old skier and sailor. I have some sun damage that I need to have addressed. Can I also have laser to get that glow back at the same time?
Absolutely. So outdoorsmen, guys, we're playing tennis, or like Ron, we're golfing, we're skiing, and you wake up one day and you look in the mirror and you look like, oh my goodness, it's like I've got some kind of cutaneous brown disease, or you have this geographic spotted brown map of the South Pacific, and so if you've got Australia on your brow and you've got a large outline of Africa on your cheek, those brown discolorations are easily treated nowadays. So in general, we use light-based treatments like intense pulse light or picofacials, and we can treat those brown spots 2 or 3 times, about 3 weeks apart, and your skin will look much more even, much brighter, much more youthful. And so I have a lot of guys who love the sun, and I see them every September, and we do a couple of photofacials and laser-based treatments. They look great, and they go back into their life and get all sun damaged again, and then I see them again. So they're treading water, but they're treading water for the right reason, because healthy skin is bright, even, and smooth, like we talked about at the top of the hour. Old skin has brown spots, and we think it's liver spots and old spots and yicky wrinkles, and so we should celebrate growing old and being wise, but you can have healthy skin while you're doing it.
All right. And those spots will come back if you go back in the sun.
If you do. And I'm a big fan of just enjoying your life. Life's too short, especially in Toronto when we're freezing half the time. Get a little judicious sun, wear some sunblock, and if you get brown and discolored, I'm there to help you.
He's there for you. Coming up in the news at 9, Syrian refugees will be arriving in Toronto for the first time tonight. Haley Cooper has the details, including who will be there to greet them. That is coming up in 15 minutes. And your calls for Dr. Stephen Mulholland, 416-872-1010. You can text us at 71010. This is The Night Side. Welcome back to the show. Dr. Stephen Mulholland is here, leading cosmetic plastic surgeon. SpaMedica.com is the website. And we're answering all of your questions about procedures that you're curious about, things that are bothering you about your skin or your nose or your eyes, and you might want to know how much it costs. We've got a few people lined up to talk to Dr. Mulholland. We'll start with Robert. Hi, Robert. Welcome to the show.
Thank you, Barb.
Go ahead with your question.
Thanks so much. So, I've got a lot of what I would call expression lines on my forehead. If you raise your eyebrows up, you get all those wrinkles in your forehead. So I've had some people tell me I should be looking at Botox, and someone else tell me I should be thinking about fillers. I'm really not too sure what the differences are. Is there something you could suggest that would be a way to smooth that out and make it not look so much like corduroy?
That's a great question, Robert, and very common for guys because we tend to have heavy brows. And that's a good thing. We don't want to feminize the brow. Guys look better with that dangerous eye, a malevolent, I can take you anytime look at Clint Eastwood circa 19, dirty, hairy look. And so Botox is an injectable chemical, very safe. It's just a protein that relaxes muscle. And most guys who have corrugated foreheads, you lift your brows, it looks like a pack of Oscar Mayer hot dogs. Then that's great for Botox. And then fillers are generally for the deep grooves, like the smile lines. And they're made of a sugar gel and they occupy space. So generally you wouldn't put a filler in the grooves on your forehead unless you are seriously suffering from overanimation. It's sort of a Botox area. It takes about 5 to 10 minutes to do. You do it about twice a year and it really relaxes the forehead. You go from looking like a worrywart to looking like you're serene. Now it's a chemical serenity, but you still look serene.
I think it's better to look good than feel good sometimes.
It's sometimes in our culture, particularly in our vanity culture, you can feel like crap, but why not look good if you're feeling bad?
Well, consider the alternative. You might as well look good. Hey, Lucy, welcome to the show.
Hi, thanks for taking my call.
Sure.
I just saw an ad on the newspaper today about a procedure where they freeze your chin to get rid of your double chin. Wondered what you thought about that, and if you don't believe in it, do you have any suggestions for getting rid of a double chin?
Well, you're right on top of things. See, that's excellent. So, cool sculpting, we talked about maybe a show or two ago here on Talk 10. And cool sculpting, it has a suction-coupled applicator that draws your fat into a chamber. It takes the fat down to 5 degrees Celsius, and about 20 to 28% of the fat cells just turn off the lights and go to sleep and die. Wow. And that's called cool sculpting. So you're referring to a new applicator called the Cool Sculpt Mini. Now, I've been doing cool sculpting at SpaMedica for 4 years. I'm a big fan of freezing fat. It's the only time living in Toronto makes any sense. If it's freezing out there, we should freeze double chins. Now, there's also another cool thing that's recently been approved where we can inject a little chemical like Botox, but it's a different chemical under your chin into the fat. It's called Kybella in the United States and Belkyra. And so you have to have the Cool Sculpting Mini for about an hour, and then you wait about 4 or 5 weeks to the result. But if you want to come in and for 5 minutes, we inject a little chemical in your chin. This dissolves the fat cells, and they're taken away harmlessly by your body. And so as long as you have a reasonably tight envelope, and you've got a little bit of a selfie chin, a selfie double chin, Kybella or Cool Sculpt Mini are two good non-surgical options. So I hope that helps.
Thank you.
All right, Lucy, thanks a lot for the call. Rob is next, and I think Rob wants to talk about something we were going to discuss anyway. Hey, Rob, welcome to the show.
Hi, thanks for taking the call.
Of course.
I've been wanting to ask this of people for a long time. I've taken about 6 years now, and I've lost a great deal of weight, looking a lot better, except I thought my skin wouldn't hang down, but it really is starting to look kind of baggy. I've still got about another 30 pounds to go to my ideal weight, and I'm wondering, am I going to have surgery to have the excess skin taken off, or will it eventually shrink and fit me again?
Well, how young are you, sir?
I'm 42.
So you're pretty young still. And, I'd give your cutaneous envelope a chance to snap back. And what is the magnitude of the weight loss, would you say, in total that you're going to lose?
Well, I've got 30 more pounds to lose, but to date I've lost, as of 3 months ago, it was 440 pounds.
Wow, Rob, congratulations.
Well, hats off to you, Rob. That's a real commitment and a lifestyle change. But I would just suggest there's a high probability bordering on a certainty. With that kind of magnitude of weight loss, your skin will not have the elastic recoil it takes to snap back into any meaningful sort of compact envelope. So, most significant weight loss patients that have morbid obesity, which is over 130 times your ideal body weight, that do it through good old-fashioned restriction or through gastric surgical manipulation like a gastric bypass or through lap band or a lap sleeve, they generally are going to have two components to their restoration. It's going to be lose the weight, stabilize for 6 to 12 months, and then a number of serial excisions. Usually the first one that patients hate is the tummy, and so it's the tummy skin or the pannus that's removed, and then followed by the neck, because the neck you can't hide, and then the arm and the inner thigh. So those are the serial excisions of weight loss, and patients who have done that hard work like you have just hate the grim reminder of the skin that reminds them of the weight they once had. So I think you're probably going to be looking at some serial excisions once you've stabilized and achieved your ideal body weight.
And if I may quickly, excuse me, doctor, if I might quickly ask another part to the question.
Mm-hmm.
After I get this done, I'm seriously considering liposuction, because a lot of people say you lose fat. You don't really lose it. You just shrink your little fat cells down. And I don't want those guys still in my system sending out the little chemical messengers for me to go down to the local pizza shop. So if I don't have the capacity in that, I don't have fat cells to store extra weight, I thought that would help me to stay slim.
Does it work that way, Dr. Mulholland?
Well, he's right and he's wrong to some extent. He's right in that there are cell signaling that occurs. Fat cells are responsible for a lot of regulation around glucagon and insulin and weight management. And so patients who've had a lot of weight loss, there will be the stubborn areas that no matter how much weight you lose, still have some fat. And so localized liposuction combined with skin resection will help you get the shape that you're looking for in the tight envelope. and then liposuction of every last fat cell of your body, although I know that they become a passionate enemy of yours, is not a practical thing. So it's going to be your basically your behavior modification, how you've changed what you use food for and how you eat, and emotional eating around disciplined eating and grazing rather than gorging, that will save you in the long term.
Okay, let's get Trinity in here. Hi, Trinity. Welcome to the show.
Hello, thank you for taking my call.
Sure.
Very quickly, I am 63 years old. My skin is very, very good on my face. I can't complain. I'm lucky. But I have some jowls on either side of my mouth, and that's the thing that really gives away my age.
Okay.
And how would you treat it? Fillers or surgery?
And would you say then the jowl around your mouth or down around the jawline?
They're sort of on the jawline on either side of my mouth.
Yeah, so
they're not like hanging, but they're droopy.
They're starting to form. And so, women and men actually hate this. It's sort of that deflation, descent. The cheeks fall. Some of the fat starts to hang around the corner of your mouth. And then it starts to, corner of your mouth starts to go downward. And then you get that mouth pout or mouth frown. And then you kind of square out, have a bit of a jowl. It's, we go from oval in our youth to kind of boxy and dowdy. And then we end up like with the shape of a pyramid where our jowl dominates our cheeks. And so in the early phases, it sounds like the early phases of your pre-jowl or early jowl, soft tissue fillers are a great option to camouflage the jowl. If the jowl gets a little more annoying and sometimes the filler makes you look a little heavier, then I'm a big fan of just suture suspension, something called a thread lift, which works beautifully. It takes about half an hour under local anesthesia with no cutting or excision. And then that'll sustain you for a while. But eventually, when you get too dowdy and too jowly, and all the energy devices and tighteners and fillers and suspenders in the world won't work, a little jowl lift is often your best friend. But it sounds like you're in the early phases of that annoying pre-jowl formation, and a little filler, Juvederm, Restylane is probably going to be a good friend for you in the next 5 years.
Welcome back to the show. We're in our final few minutes with Dr. Stephen Mulholland. He's agreed to stick around till 9:15. If you have any questions regarding procedures that you've been thinking of having done, 416-872-1010. You can text us at 71010. I did want to get to, we have a lot of text questions, so I'll see if we can do a couple of them. How hard/expensive is a tummy tuck? That's one of the most popular procedures, certainly that women will do, and some men. So there are different types of tummy tucks. You could classify them as a mini tummy tuck. A mini would be this little incision just above the pubic hair, about the size of a C-section. And you're removing just a little bit of loose skin below the belly button and not working on the muscle or just working on the lower part of the muscle. That's a mini. And that'll run in Toronto and most major urban centers in Canada between $4,000 and $6,000, and it will include the anesthetic and the post-op care. Then you've got your standard tummy tuck where you're not just lifting the skin below, but above. You're making a new belly button and likely tightening the muscle. That's your standard tummy tuck. The incision now goes more than a C-section to maybe just the start of your hip bones. And that will run somewhere between $8,000 and $9,000, depending if you do a little bit of liposuction on the love handles and the flanks, which often patients will do. And then you have what's called an extended tummy tuck, where that incision keeps going around the hips and sometimes even to the back for total body lift, but it goes around beyond the hips for massive weight loss, and will usually always include then restructuring of the stomach muscle, both in the center and the side, making a new belly button, and the addition of some liposuction. That might be anywhere from $10,000 to $14,000, depending on the size of the patient. All right, we've got some calls coming in for Dr. Stephen Mulholland. Louise is next. Hi, Louise.
Hi.
Hi, go ahead with your question.
Yes. I was suggested by my endocrinologist that I get half my thyroid taken out because I've got a Hürthle cell, which means there's a potential for cancer, but I don't know what to do. It's kind of a tricky situation. Do I get it out just because of the potential?
Oh, that's an excellent question. And, I used to be a head and neck cancer surgeon, so it's a fortuitous night.
Isn't that interesting?
But when you have a cell, a thyroid cell, that has the potential to become oncologic cancerous or a nasty tumor, The decision to remove it or not to remove it's got to be balanced by your health, your age, your ability to and willingness to undergo surgery where there's a small incision at the base of your neck, the thyroid is explored, and the hemithyroid, the size of the side of the thyroid to remove is accessible. Now, it leaves the other side of your thyroid. It leaves your parathyroid glands intact. You are likely not going to need thyroid replacement hormone for the rest of your life. And so that's a decision you and your endocrinologist should make. You can follow with use of ultrasound or MRI the thyroid gland. But I'm a big fan, having seen many people die from head and neck cancer diseases, that if you have a chance to remove something that has a significant chance of turning cancerous, for want of a fairly short and inintrusive operation, I think a hemithyroidectomy is something you should seriously consider.
All right. David is next. Hi, David. Welcome to the Night Side.
Hi. Thank you for taking my call.
Sure.
Hi. Since I was a kid, I've had a flabby chest, and it doesn't seem to matter how much I weigh. And as I'm getting older, I'm looking more like Dolly Parton all the time.
Oh, now.
Well, I'm all my life I've been embarrassed to take my shirt off on the beach, and I'm wondering if I can do anything about it.
All right. Not uncommon, right, Dr. Mulholland?
Yeah, we talked a bit about that earlier. It sounds this might be more of a fatty degeneration with a little glandular tissue. So if you can pinch behind the nipple areolar complex, and if the male listeners out there, and you feel a disc of hardness, that's gland. And then usually as you go out beyond the areola to the rest of the chest, and it's kind of loosey-goosey, that's going to be fat. And then if it's not too much loose skin, something like body tight or smart lipo, if you look up those terms, can be done through very small incisions under local anesthesia, liquefy the fat, liquefy the gland, tighten the skin, and you get away without any scars. If you happen to be standing and your breast folds over in itself and you can hold a pencil or, God forbid, the whole Laurentian pack, then you may need to actually have chest skin scars called a breast lift. And hopefully you fall into the former category and can do it with very small incisions.
Okay. Steve is next. Hi, Steve. Welcome to the show.
How are you tonight?
We're good, thank you.
Good. I'd like to know, when you get older, I've been developing aging spots on my arms and my face, and what can be done about that?
Well, brown spots are a very common stigma of aging, and they're not a nice part of aging, because we look at those and you think of your grandpa and age spots and when
liver
in the
spots.
in the 60s, 70s, we must have liver failure, and there's all these things that we associate with brown spots. And so we've got some very, very, very cool lasers now, picosecond lasers that can shatter that brown pigment in a matter of seconds, and then it sort of flakes off. And so brown spots have never been easier to remove. And then once you've invested in removing them, and it may cost you a few $100s to get them all removed from your arms or your hands, there's a period of redness while the redness fades. And then you need to just, be a little more diligent about applying sunblock when you're outside and outdoors so they don't recur. So search out a dermatologist or plastic surgeon that has lasers, particularly the Pico laser, the Pico Sure.
All right. Phil, welcome to the show with Dr. Mulholland.
Hi.
Hi.
I've been recently diagnosed with trigeminal neuralgia. It's extremely painful, and I went to my family doctor about it, and he gave me a prescription for carbamazepine, but I would really like to go see a neurologist about it, because I know it can be triggered by tumors and cancers in my family. I'm just wondering how I might approach that with my doctor without being kind of heavy-handed.
Well, trigeminal neuralgia, for the other listeners out there, there's a nerve called the trigeminal nerve that comes out of the mid-cheek, and you can get a number of syndromes and diagnoses can stimulate pain in that nerve, and it's very debilitating. And there are a number of, first of all, you want the right diagnosis. You're right. Rule out things compressing the nerve, rule out tumors and cancers, rule out obstructions and lesions that can be treated. And that's going to be with a CT scan or an MRI. And your family doctor either has to order or refer you to a neurologist or to a head neck ENT physician. And then sometimes there's no cause found, and then you're treating this neuritic pain. And there's pain specialists, and the big hospitals like Toronto General Hospital have a pain service, and they'll help you put on non-narcotics. Carbamazepine is one option. There's gabapentin, and sometimes even injections into the trigeminal nerve to try and knock it off. And then in pain is another option. So you just need the right referral network. Hopefully your family doctor will tie you in.
Okay, let's try to squeeze in one more. Roger, we don't have much time, but I want to get your question in.
I'm going to have to lose a lot of weight, like 130 pounds over the next year and a half, and because I'm on disability, I won't have funding or insurance. Is it true that if you drink water while you're losing a lot of weight, you can avoid the loose skin, or is there anything I can do to avoid loose skin, like exercise or whatever?
Yeah, there's a number of things you can do. Eat well, eat healthy, make sure your skin doesn't get depleted of minerals and nutritional substances while you're dieting. So diet responsibly, keep well hydrated, exercise, build up your muscle tone because the muscle will stretch the skin, a little taut over top of it. And then the best thing that you'll have going for you is the genetic code of the two people that made you. And sometimes we can't overcome the gene code. So if you have good elastic skin, it could withstand 130-pound weight loss. You may not need excision. And then if you do have the heartbreak of skin laxity, we talked about this last month, that over 50% of all patients I see now finance their cosmetic surgery.
Oh, yeah, we
they
talked
go
about
through
that.
services like iFinance Canada and others where you don't need a cosign or a bank loan. And you can look at any part of your body, and usually it's going to add up to about $90 to $120 over 5 years to 72 months. So there are affordable ways to deal with the heartbreak of realization that you can't do it on your own. And let's just hope your genetic code and healthy lifestyle win out.
Dr. Stephen Mulholland, thank you so much for this. As you mentioned, if people do have questions and they want to send out tweets to you at SpaMedica Toronto, I believe is your Twitter handle, you will answer those. And the website is SpaMedica.com. And we will see you soon. Thanks so much.
Thanks again, and have a happy holiday.
Oh, yes. And same to you.